Welcome to Dynamic Medicos. In this video, I am going to talk about dyspepsia. Dyspepsia is a collective term for any symptoms thought to originate from the upper gastrointestinal tract. Dyspepsia describes symptoms such as discomfort, bloating, and nausea, which are thought to originate from the upper gastrointestinal tract. There are many causes, including some arising outside the digestive system. Heartburn and other reflux symptoms are the separate entities and considered elsewhere. Let's see what are the causes of the dyspepsia. First, in the upper gastrointestinal disorders like in peptic ulcers, acute gastritis, or in the gallstones, esophageal spasm, or the non-ulcer dyspepsia, irritable bowel syndromes. Other gastrointestinal disorders such as pancreatic disease like in cancer or the chronic pancreatitis. Second is colonic carcinoma and hepatic disease like hepatitis and the metastasis. Systemic disease like in renal failure or the hypercalcemia. Another causes are the drugs which are non-steroidal anti-inflammatory drugs, NSAIDs, then glucocorticoids, iron and potassium supplements or the digoxin. Then next is other causes like psychological causes like anxiety and depression or the alcohol. Let's see the mechanism. The first is gastroesophageal acid reflux. Second is gastric motor dysfunction. Third is visceral afferent hypersensitivity. And next is other factors. Let's see the gastroesophageal acid reflux. It is reduced lower esophageal sphincter tone, frequent transient lower esophageal sphincter relaxation, and overeating and aerophagia, that is air engulfation, and impaired esophageal body motility and the reduced salivary secretion also leads to acid reflux, or it can be due to the hiatal hernias. Next is gastric motor dysfunction. It's delayed due to gastric emptying and impaired gastric fundus relaxation after eating. Visceral afferent hypersensitivity. Disturbed gastric sensory function is proved as a pathogenic factor in the functional dyspepsia. Then individuals with the functional heartburn are believed to have heightened perception of the normal esophageal pH. Now let's see clinical features of the dyspepsia. Weight loss, anemia, vomiting, hematemesis, and or a melena, dysphagia, probable abdominal mass. Let's see what are the investigations and the management of the dyspepsia. When the patient comes with the complaint of dyspepsia, first check for the alarming features. If it's present, then urgent endoscopy should be done. And if it's not present, then we will look for the age of the patient. If he or she is less than 55 years of age, then we will test for the Helicobacter pylori, like example for serology or the stool antigen test. And if it comes positive, then we will do the Helicobacter pylori eradication. If the symptom resolve, then no follow-up should be taken, and if the symptoms still persist, then we will do endoscopy, and if it's come negative, then we will treat it symptomatically or consider other diagnosis. And if patient's age is more than 55 years of age, we will directly do the endoscopy to rule out the cancer. Now let's differentiate dyspepsia from the heartburn and the regurgitation. Heartburn describes the as a retrosternal burning discomfort, often rising up to the chest and sometimes accompanied by a regurgitation of the acidic or the bitter fluid into the throat. These symptoms often occur after the meal, on lying down, or with the bending or the straining of or the lifting the heavy weight. They are classical symptoms of the gastroesophageal reflux, but up to 50% of patients present with other symptoms such as chest pain, belching, halitosis, chronic cough, or the sore throat. In young patients with the typical symptoms and good response to the dietary changes, antacids and acid suppression investigation is not required. But in patients over the 55 years of age and those with the alarming symptoms or the typical features needs the urgent endoscopy. Thanks for watching the video. Please do like, share and comment on my video and subscribe to my channel Dynamic Medicos.